Importance of deciduous dentition. First, we look into the importance of deciduous dentition for the proper development of muscles, of mastication and formation of bone in jaws. Normally, alveolar bone develops when primary teeth erupt. Jawbone formation contributes to the vertical growth of the face. Muscles of mastication develop properly when they start to function. This neonatal skull shows edentulous dentition, stating that the teeth are not in the jaw bones. So the face is very short. And this second picture shows the 4 years old skull where deciduous dentition is developed, erupted actually. So you can see increase of this height of the face in the skull with the eruption of teeth. Here in this picture you can see that the deciduous dentition is always located above the developing permanent dentition. Therefore, this deciduous dentition is there to determine the location, alignment and occlusion of permanent teeth. Third importance is space maintenance for permanent teeth. Here in this picture you can see generalized spacing between deciduous dentition. It is how this deciduous dentition maintain the spaces for bigger permanent teeth. It also maintains the space for permanent teeth by having primate spaces in upper and lower jaws. These spaces present between primary teeth of lower lateral incisor and lower canine, and in upper arches it's present between canine and the first premolars. Further, it maintains the space for permanent teeth by having leeway space. In these two pictures, in deciduous dentition and permanent dentition, you can see the space occupied by the length of the occupying length of the CDE is greater than the occupying length of the 3, 4, 5 in the dental arch. So there's an additional space that is created after the exfoliation of the CDE is called the leeway space, and this additional space is needed to accommodate the erupting permanent teeth into the arch properly. The next important fact is that this deciduous dentition is there to avoid mesial movement of permanent first molars, which is called mesial drift. It occurs if primary teeth are interproximally decayed and teeth are not restored properly. It is a one fact. And if primary teeth are prematurely lost, the first molar will be moved into that space thereby the space for premolars will not be enough, causing alignment and occlusal problems. In next importance, restoration of deciduous roots guides the eruptive permanent teeth into proper location. Lastly, it is important in nutrition of the child and speech and aesthetic of a child.